Hello there, I'm Tony Mecham, Oral and Maxillofacial Radiologist, and today I'm going to be talking about bone fractures, everything about fractures, including healing and different types of fractures. This is really important for dental students looking to review for dental boards. So these are the basic four things we're going to talk about today, describing the phases and stages of healing and their timeline. Recognize the types of fractures, identify the causes of non-healing, and then also recognize symptoms and the timing of fat embolism sequela. These are the different resources I use if you're interested. So we can talk about histological stages or phases of fractures, depending on the source you're using. So there are 5 different histological stages: the fracture hematoma formation. So this is immediately after the fracture. The second stage would be granulation tissue or inflammatory tissue that starts to accumulate around the fracture line. Third stage would be callus formation, then lamellar bone formation, then remodeling. If we're talking about the 3 different phases of bone healing, then just take those first 2 of the stages. Those are the reactive inflammatory phase. Then the second 2 stages are the reparative phase. And then this is similar. We just have the remodeling phase, which is going to be similar to the remodeling stage. If you want a mnemonic, cheesy mnemonics are always the best way to learn. And so think of a grandma falling on your laminate tile and she damages the tile. So first thing you think is you got to get that remodeled. So, hey, Granny, call laminate remodeling. Yeah, really cheesy, I know, but that may help you remember. And as far as the timing of these different stages, really to just summarize it, think hours, then days, then weeks, then months, then years. It doesn't really make sense to memorize exact times because everybody's going to be different. A lot of it's going to depend on your age, how fast your cells are turning over. But think of that first phase, that first stage as just being a few hours. And then within the first couple of weeks, that's when the granulation tissue starts to form. Callus formation happens more on the order of weeks. So we're talking about 2 to 3 weeks, usually less than a month. Of course, that varies. And then lamellar bone formation, that's where we're talking months. So at least 3 weeks to several months. And then remodeling can take a long time. In older patients, it may never completely remodel. In younger patients, it may look better within a year. And so, like I said, it varies a lot, but just kind of have a rough idea of the timing of the different stages. And so I'm just going to go through each of the stages individually. Hematoma starts happening immediately, rupturing blood vessels. So blood starts to form inside the fracture. A blood clot is what provides the initial seal around the fracture and what makes it able to start healing. And so within the first day, so again, I said think of that first stage as being hours. The granuloma, so this is more your chronic inflammatory stage, so within a couple of weeks. And for my students, you don't have to memorize all the cytokines that are released by inflammatory cells. Just know that that triggers the stimulation of osteoclastic and osteoblastic activity. As you know, osteoclasts are resorbing bone, and so some of the fragments of bone need to be resorbed so it can be properly healed. And then osteoblast is what lays down new bone. And this is sometimes called the soft callus formation. Usually when I'm referring to callus and when most people talk about the callus of bone healing, it's more the next stage, which is the hard callus, and that's when you start to see calcification. But this may be called the soft callus. Just think of inflammatory, granuloma, all these go together. So yeah, when I talk about callus, I really am usually talking about the hard callus. And this is when radiographically you're going to see calcification outline the fracture line. This is within, in most cases, less than a month. So this is the one we talk about within weeks. And this is where osteoprogenitor cells, these pre-osteoblasts, deposit woven bone. What do we mean by woven bone? That's just irregular bone that doesn't really have the normal bone pattern. And so that's happening within a month. The one that usually takes weeks to months is the lamellar stage. And that's where the cartilage starts to undergo endochondral ossification, new trabeculation are formed. It's really starting to form more of a normal bone pattern where you have marrow space interspersed by trabeculae, and that's outlined by the cortical bone. And so these are nice little graphics I took from radiopedia.org, but I just kind of like how this shows the progression of bone healing over time. So here's a normal bone, so you're in the medullary cavity, even shows some veins, arteries going through it, cortical bone. And so here's the initial fracture, and what's the first thing that happens? What's our first stage? Think back to our mnemonic. Hey, Granny. So the hematoma formation, that's going to be first, and that happens within hours. And you do get this fibrin mesh seal that kind of just seals everything together. So again, that's just within hours. Think of days as the next step, the granulation tissue, these inflammatory cells that start to migrate to the source of injury. And that's what starts releasing cytokines, signaling the osteoclasts and osteoblasts to do their job. And so this is still just part of that previous phase, the granuloma stage, just showing more of the revascularization, which I didn't really talk about previously. And this also talks about that same stage. We're talking about inflammatory, kind of the hematoma stage, maybe a little bit more where you have some fibrocartilage outlining the fracture line. And then this would be the callus stage, or the hard callus stage. It really starts when you just start to see calcification around the edges of the fracture. And then remodeling phase. And this is the one that lasts months to maybe even years before it's completely remodeled. And so here are all those images, just taken all together. And these next two slides, I want to show you kind of the difference between children and adults in bone healing. So you notice this is a humerus, and this is a femur in a child, day 1 of fracture. Day 4, we still don't see much. By day 7, so within a week, we're already seeing that hard tissue callus. What did I say typically is the timeline for the hard callus formation? That's usually 2 to 3 weeks. So you can see in this infant, it's been sped up quite a bit. Here it is only 2 weeks later, and it's already moving into the remodeling stage where that hard callus is really established. And within 6 months, this patient almost looks completely healed. So you can see very fast healing in infants. Same thing with this femur. But if we compare that with there's maybe a middle-aged patient, fracture of a fibula, 6 weeks later, so it does take quite a few weeks, and you do have a formation of a good hard callus. Maybe it's starting to move into that lamellar phase. And then here we have an older gentleman with a fracture, day of surgery. Here you can see they inserted a rod into a humerus. And it took 6 weeks before you start seeing signs of calcification for that hard callus to form. We usually said that was within weeks. And here it is 6 months later. It is healing, but you can tell it's compared to that infant on the last slide, it's taking a lot longer. So 6 months, even if you looked at a year later, you'd probably still see signs of it. It's not completely remodeled. And so just know that it varies patient to patient. A lot of it is determined by age. And then this slide just summarizes everything, if you want to use that as kind of a review slide. But let's get into types of fractures. This is important. I'm going to try to keep it pretty simple. We won't go to every type of fracture in the book, but simple, just kind of an easy way to describe a typical fracture. The skin is intact. Compound is when it does pierce through the skin, so be able to recognize that difference. Comminuted is when it's crushed into several different pieces. Displaced is just kind of describing how two different ends of the fracture are no longer aligned, and sometimes that requires surgery, but those places have to be better aligned for it to heal properly. Stress fracture is one where slowly developing fractures follow a period of increased physical activity. A greenstick fracture, who does that occur in? So here's my greenstick, kind of showing what it looks like. So that typically occurs in children where they have a little bit more malleable bones, and the cortices will a lot of times remain intact. And that's what we're seeing right here. See how the cortices still pretty much align? You can imagine that like taking a green stick and breaking it, and it doesn't break all the way through. If you're like me and you have a few kids, you've probably seen a few of these, unfortunately. And so kids are susceptible to those. A pathological fracture is just like it sounds like. It's when you have pathology that weakens a bone. And really any type of pathology can do this as long as it started to resorb the bone. Even when we're talking about osteoporotic fractures, that's pathology. It's pathology that's weakened the bone that may have led to that fracture. But in a lot of other cases, I'll be talking about, ameloblastoma, OKC, any of these tumors that can resorb enough bone that it becomes weaker, and that can cause it to fracture. And for my students, mainly just be able to recognize these 3 pictures right here. And if I'm going to talk about a compound fracture, there's going to be something specifically indicating that there's broken skin. I'm probably not going to show you an image of a bone protruding through skin. I'm a radiologist and blood scares me. Not really, but just recognize these images. So it was this one. This was on the previous slide. Green stick fracture. See the cortical bone still kind of remaining intact. So this was our compound fracture. And then this one was what? This is comminuted, where it's fractured into multiple places. So just be able to recognize these 3 images. Do be able to identify causes of failure to heal of fractures. Mobility, this is why we stabilize bone. Obviously, it helps it heal a lot quicker. If there's excessive mobility, it's going to lead to a false joint, pseudoarthrosis. Another thing that can happen is interposition of soft tissues. So especially with excessively displaced or comminuted fractures, then soft tissues can kind of grow in there. You get this fibrous soft tissue healing. rather than proper bone healing. Infection obviously can affect healing if infection gets in there. And also, it's going to be a lot more likely with compound fractures. Obviously, if you have the skin broken, then bacteria can get in there and cause an infection more likely. Ischemia, any area that's poorly vascularized or at risk of coagulation necrosis, so that can affect healing. And then one last slide here for this video, just recognize fat embolism, what it is, when it tends to occur, how to maybe recognize it. This is a common sequela that happens. Usually doesn't cause symptoms though. Fat always escapes when you have a fracture. And so you get these microscopic fat globules into circulation. Those can alter plasma lipids. And this can cause symptoms in areas away from the fracture. So for example, if it affects the lungs, can lead to pulmonary insufficiency, neurological symptoms, anemia, thrombocytopenia, can be very significant in some patients. In some cases, a petechial rash. When does this occur? It occurs usually 1 to 3 days post-injury, and it can cause sudden onset of tachypnea, dyspnea, tachycardia, irritability, restlessness. So one example you might see is a child comes into your office, maybe they're wearing a cast, it's been just a few days since fracture, and they start to just seem out of it. It's not the medication you gave them, but they start to maybe breathe really fast, their heart's going fast. It could potentially progress to delirium or even a coma. So just recognize that. And that's it. Watch for the next lecture. We'll see you then.